The Animaniacs?
Oh, Animaniacs? Did they say that?
Yeah.
They stole that from Rocky and Bullock. So Rocky says every before they do anything like fractured fairy tales. Now here's something we hope you'll really like. It's his arm out. Animaniacs is good. It's good stuff. All right, cardiovascular emergencies. Here we go. Preparedness is everything. Those of you that were prepared for the test tonight passed it. Those of you who were not prepared did not make it. Makes a difference in a split-second decision also. If you know how to use your equipment, you know what it's used for. And you practiced it so you can't get it wrong. You're able to do things in a split second without having to think about it. It's automatic or autopilot. Talking and dreaming is easy. Taking action, though, is what accomplishes things that you need in life and how to save a life. One of the few good things people will say about me is they'll tell you I'm a robot, so I can do things automatically without thinking about it. That's because I practiced it and I've done it millions of times. Again and again and again and again and again.
How many times again?
Again
Again.
and again. So pretty soon it becomes automatic, so you can do it even in the dead of sleep. The autonomic nervous system? No, it's not. I'm gonna be thinking about that though. It's gonna make a good joke someday. That nobody will understand. Yeah. Give you a little credit, some kind of credit, inspired by. Inspired by. So we're gonna learn today. We're gonna learn about the basic anatomy and physiology of the cardiovascular system, which is pretty fascinating. Describe it and understand the anatomy and the physiology, the assessment and management of the following things: angina pectoris, thrombolism, myocardial infarction, which is abbreviated MI, hypertension, abbreviated HTN, and the difference between an aortic aneurysm and an aortic dissection. Actually, a dissection is aneurysms to get the bubble. So when the bubble goes to dissection. Cool. Now we don't have to do the last half of the lecture. We're going to discuss the anatomy and pathophysiology of the cardiovascular system, understand the assessments, and know what to do. We're also going to go over nitroglycerin, what it does, when you should give it, when you should, and the same with an automatic external defibrillator. Any questions? It's what tears off, dissects.
The dissection is
Tears off.
supposed to be when the section tears off, and then that is just
Tears off.
so
Any questions? All right. 2.6 deaths. I was wrong. I lied to you. It's a 2.5. It's actually 2.6. You guys think you're funny? Sound like Charlie Brown teacher? What? All right. Kills about 2 people a minute. It's a death under 30 seconds. By the time we're done with this lecture, 120 people will have died from this. Pretty bad. You have to know the blood flow through the heart. You have to know it. Any questions? Your tests aren't done. I'm going to quiz you on it at the end of class tonight. You have to know it. You should have it memorized by now.
that is the best diagram of the heart,
Thank you. I drew it myself.
like showing the valves.
Yeah. To me, it kind of looks like the LA freeway system. All the off ramps and on ramps and intersections. All right. Now here's something we hope you'll really like.
One of the most amazing organs in your body. This is the human heart, and it's shown with all the vessels on it, and you can see the vessels coming into it and out of it. But the heart at its core is a pump, and this pump is why we call it the hardest.
All right. Lifting and moving patients. The guy narrating the video, the paramedics letting the gurney fall down, almost get hit by the car. I swear to God, this is the same guy. Listen to the way he talks.
Working organ in our body, because it starts pumping blood from the point where you're a little fetus, maybe about 8 weeks old, all the way until the point where you die. And so this organ, I think it'd be really cool to look at in a little bit more detail, but it's hard to do that looking just at the outside. So what I did is I actually drew what it might look like on the inside. So let me actually just show you that now. And we'll follow the path of blood through the heart using this diagram. Let me start with a little picture in the corner. So let's say we have a person here, and this is their face, this is their neck. I'm going to draw their arms, and they have in the middle of their chest their heart. And so the whole goal is to make sure that blood from all parts of their body, including their legs, can make its way back to the heart, first of all, and then get pumped back out to the body. So blood is going to come up from this arm, let's say, and dump into there, and the same on this side. And it's going to come from their head. And all three sources, the two arms and the head, are going to come together into one big vein. And that's going to be dumping into the top of the heart. And then separately, you've got veins from the legs, meeting up with veins from the belly, coming into another opening into the heart. So that's how the blood gets back to the heart. And anytime I mention the word vein, I just want you to make sure you think of blood going towards the heart. Towards the heart. Now, if blood is going towards the heart, then after the blood is pumped by the heart, it's going to have to go out to the heart, right? It's going to have to go away from the heart. So that's the aorta. And the aorta actually has a little arch like that, and we call it the aortic arch. And it sends off one vessel to the arm, one vessel up this way, a vessel over this way, and then this arch kind of goes down, 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 and splits like that. So this is kind of a simplified version of it, but you can see how there are definitely some parallels between how the veins and the arteries are set up. And arteries, so anytime I mention the word artery, I want you to think of blood going away from the heart. And an easy way to remember that is that they both start with the letter A. So going to our big diagram now, we can see that blood coming in this way and blood coming in this way is ending up at the same spot. It's going to end up at the, actually maybe I'll draw it here, is ending up at the right atrium. Right atrium. That's just the name of the chamber that the blood ends up in. And it came into the right atrium from a giant vessel up top called the superior vena cava. And this is a vein, of course, because it's bringing blood towards the heart. And down here, the inferior vena cava. Inferior vena cava. So these are the two directions that blood is going to be flowing. And once blood is in the right atrium, it's going to head down into the right ventricle. So this is the right ventricle down here. This is the second chamber of the heart. And it gets there by passing through a valve. And this valve and all valves in the heart are basically there to keep blood moving in the right direction. So it doesn't go in the backwards direction. So this valve is called the tricuspid valve. Tricuspid valve. And it's called that because it's basically got three little flaps. That's why they call it tri. And I know you can only see two in my drawing, and that's just because my drawing is not perfect. And it's hard to show kind of a flap coming out at you, but you can imagine it. So blood goes into the right ventricle, and where does it go next? Well, after that, it's going to go this way. It's going to go into this vessel, and it's going to split. But before it goes there, it has to pass through another valve. So this is a valve right here called a pulmonary valve. Pulmonary valve. And it gives you a clue as to where things are going to go next, right? Because the word pulmonary means lungs. And so if this is my lung on this side, this is my left lung, and this is my right lung on this side, Then these vessels, and I'll let you try to guess what they would be called. These vessels, this would be my, make sure I get my right and left straight. This is my left pulmonary artery. And I hesitated there just to make sure you got that because it's taking blood away from the heart. And this is my right pulmonary artery. So this is my right and left pulmonary artery. And so blood goes now into my lungs, right? These are the lungs that are kind of nestled into my thorax where my heart is sitting, goes into my lungs. And remember, this blood is blue. Why is it blue? Well, it's blue because it doesn't have very much oxygen. And so one thing that I need to pick up is oxygen. And so that's one thing that the lungs are going to help me pick up. And I'm going to write O2 for oxygen. And it's also blue, and that reminds us that it's full of carbon dioxide. It's full of waste because it's coming from the body, right? And the body's made a lot of carbon dioxide that it's trying to get rid of. So in the lungs, you get rid of your carbon dioxide and you pick up oxygen. So that's why I switch at this point from a blue colored vessel to a red colored vessel. So now blood comes back in this way, and dumps into this chamber. So what is that? This is our left atrium, So just like our right atrium, we have one on the left. And it goes down into, and you can probably guess what this one is called. It's our left ventricle. So just like before, where it went from the right atrium to the right ventricle, now we're going from the left atrium to the left ventricle. And it passes through a valve here, right? So this valve is called the mitral valve. And its job is, of course, to make sure that blood does not go from the left ventricle back to the left atrium by accident. It wants to make sure that there's forward flow. And then the final valve, and I have to find a nice spot to write it, maybe right here. This final valve that it passes through is called the aortic valve. And the aortic valve is going to be what divides the left ventricle from this giant vessel that we talked about earlier. And this is, of course, the aorta. This is my aorta. So now blood is going to go through the aorta to the rest of the body. So you can see how blood now flows from the body into the four chambers. First into the right atrium. This is chamber number 1. And then it goes into the right ventricle. This is chamber number 2. It goes to the lungs and then back out to the left atrium. So this is chamber number 3, and then the left ventricle. And this happens every moment of every day. Every time you hear your heart beating, this process is going on.
That help? He's better than me, I know. I like his video, the very normal, like that's better. All right. This is important to know. May not be on the test, but it'll help you understand questions on the test. So your heart has its own electrical generation system. Unique muscles, you generate its own electricity, right? Through potassium, calcium pump goes back and forth by osmosis, it's electrical generation. Then any cell inside the heart can be a pacemaker. And the way the heart beats is by having a synchronized depolarization, kind of like turning a light switch on or turning a light switch off. Okay? So that was a picture of ascites I just erased. What happens when your liver fails from drinking too much alcohol? Stay away from alcohol. So everyone who's experienced Valentine's knows what a heart looks like. Doesn't look like a ridiculous diagram. It's like a Valentine, right? So yeah. So we got the right atrium at the top, the right ventricle, left atrium, left ventricle. All right. So the right atrium is your pacemaker. It sets the beating of your heart. It's called the SA node, sinus atrial node. Okay. So what that does is it depolarizes. when it depolarizes, that sends a signal down to this dude called the AV node, the atrioventricular node. And he manages a spot called the AV junction. Then the AV junction, when it gets that depolarization, it sends out down the bundle of his to the right and left ventricles, all kinds of depolarizations. Then all at the same time, the ventricles all depolarize, and that's what causes the heart to beat. Okay? Next, the atriums beat when the SA node goes. That's a whole second thing. But where the blood actually pumps out to the cells, where the ventricles beat. So the cool thing is, Dr. Zoll, 100 years ago, figured this out by putting his wife in a bathtub of salt water and hooking alligator clips to her fingers and her toes and finding it on an oscilloscope. Pretty amazing they figured this stuff out. So you can actually see the depolarization of the cells that goes in order. So everyone's seen what an EKG looks like, right? You see it on the side of every ambulance. It looks like this. Roughly, right? What that is that's this synchronized depolarization. Now, I'm a simple guy. So you start talking about depolarization and binary numerations, that gets really, really confusing. So I grew up in the 70s. We didn't have cell phones and video games like that. We had to like do hard stuff to entertain ourselves. So we did dominoes. So anybody ever watch dominoes? You line dominoes up, you knock them over. So I look at this as like the SA node is the first domino. You knock it over, it goes click, 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 click. And then with the AV junction, it's like a ruler. When it hits that ruler, then it sends out a whole bunch of dominoes. That's what depolarizes the heart. Cool way of looking at it. So when the SA node depolarizes, that gives you that first little bump. That's the peak. Then you get this kind of straight line where nothing's happening. That's because that's going down to the AV junction. But when it goes down the bundle of his and gets the ventricles to beat, this is your actual heartbeat. And they call it a QRS. Now, it's done, right? Well, you need your heart to beat again. It's got to beat at least 60 times a minute, right? So in order for it to beat again, someone's got to go out and put all the dominoes back up. So that's called repolarization. It has to be repolarized. I know we talked about the commotio cordis, but we didn't really explain what it is. So the other way to think of it is depolarization is turning a light switch on, and the next guy turns the light switch on, and somebody's got to go down and turn all the light switches off so to turn the light switch back on again. So the whole heart has to repolarize. And that's what this last one is. The T wave is the entire heart repolarized. Okay? So you might go, why do I need to know this as an EMT? It's critically important. So this is what happens. That's normal, healthy, everyday people. Okay? So when you run into trouble, coronary arteries start getting plugged up with fat calcium. They can't pump as much blood to the heart, can hear them. Now, if the SA node dies or the AV junction dies, any cell can take over and become the leader of the heart. Anybody can. That's what keeps you from dying quickly. Because otherwise, the SA node died, you'd be dead. So it's a pretty cool backup system. But it's a double-edged sword because everything's got its flaws. So if your ventricles start becoming hypoxic from narrow coronary arteries or too much demand, the workload, like you're walking up a staircase and your arteries are too thick and can't get blood to your heart, ventricles start going, yo, SA node, you're not beating fast enough. Okay? And so what happens is they know they're dying, they know the SA node's not picking it up pace enough, so they'll start trying to take over. So what will happen is one of them will depolarize, a cell in the ventricles depolarize before the system synchronizes. And so then it depolarizes backwards and then the heart doesn't beat. So that's how you get these skipped beats. I get them all the time when I drink too much caffeine. So what will happen is you'll see, oh, look at this, I got a nice, perfect EKG rhythm. Then all of a sudden you'll see this. What that is, that's one of the ventricles going, dude, I'm taking over. But it doesn't work because they depolarize too early before the blood's in the ventricles. Goes back to your heart, goes bump, 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 bump. No big deal. This happens to people, millions of people, every minute of the day, every hour of the year. Not a big deal. When it becomes a problem, is when you get a bunch of them start doing it. And too many of them start doing it, Then you start getting a really irregular heartbeat. You start throwing these, they all come from different, they all look different. It's different assholes, excuse me. It's different ventricle cells trying to take over. And then what happens is if one of them does it during the repolarization phase, then it stands completely ruins the entire thing and everything becomes chaos. All the cells start trying to depolarize at the same time. And what your EKG looks like is just completely random, like that. That is ventricular fibrillation, causes sudden and instant cardiac death. This is where an AED is so important, because when an AED comes, you're not shocking them back to life. What the AED is doing a reboot. Like pulling the battery out of your cell phone or shutting the computer off and starting it over again, starting it up again. When you defibrillate someone, it sends a blast of energy through the heart, shuts all the cells up. Trying to get the SA node to take over to this leader to get the synchronization going again. It's a reboot of the heart, is what defibrillation is from the AED. Or like I like to think of it is, you get a couple drunks here in a bar, and the old West starting to get into a fight. Hey, if you've seen old Westerns, you'll know what I'm talking about. Then pretty soon, they'll start hitting each other with beer mugs and breaking tables. Then pretty soon, the entire saloon's in chaos. They're all breaking beers and throwing tables at each other, hitting each other with chairs. How does that always stop? How do you break up a bar fight?
Gunshot.
Sheriff comes in and shoots a shot through the roof. The sheriff is the AED with the gun. When he shoots that, that's the AED blast. Try to take over again so the sheriff can take charge and get your heart beating again. That makes sense? So that's why AEDs are so important. And that's what you're doing with an AED. A lot of people think it's the old Frankenstein. He's alive! You know, shocking Frankenstein, you get aroused. It's not actually shocking, it's depolarization. Yes.
Where does the left ventricle come into this?
The left ventricle and the right ventricle are at the bottom.
Or sorry, left atrium.
The left atrium? It's just kind of a nobody. So the left atrium, when it goes down here, you do get depolarization there in the right atrium, left atrium contract, and sends the blood down the left ventricle, which is actually during this phase right here. It's called the PR interval. And that's when that happens. Where the left atrium comes into play, which is really not going to apply to you guys, but will apply to the two paramedics in the room. It is more predominant females than males. But sometimes they have some extra electrical tissue in the right or the left atrium. And sometimes it'll shortcut it around. It's called a re-entry phenomenon. They can send their heart rate off to like 200, 300 beats a minute. Huh?
Why us?
Genetics. Yes.
So they case like a pericardial tamponade and you slap an AED on that thing.
It's not gonna do
It's not gonna do
it.
anything, right? Or like if a contusion's too bad and the muscle
Well,
can't.
contusion it might, because contusion is gonna be bruised tissue that can cause an irregular heartbeat. If one of your regular beats goes during repolarization, goes to be fifth,
Mhm.
and you're rebooting it, so that actually could help the cardiac contusion.
Good, so it's not like it's too active,
But the tamponade, that's obstructive shock. It won't help at all.
right? Okay,
We'll
gotcha.
do a darn thing.
Mhm.
Any questions? So that's the simplistic cliff notes for IMD with this. I'll watch some videos, people can explain it much better than me.
Will we be more confused by them or by you?
It's a crapshoot.
Hard to tell them not knowing.
Ms. Harris says, had enough.
Yeah, I understood your side pretty well.
I thought I explained it pretty well.
To the atrioventricular node. Action potentials pass slowly through the atrioventricular node to give the atrium time to contract. They then pass rapidly along the atrioventricular bundle, which extends from the atrioventricular node through the fibrous skeleton into the intraventricular septum. The atrioventricular bundle divides into right and left bundle branches, and action potentials descend rapidly to the apex of each ventricle along the bundle branches. Action potentials are carried by the Purkinje fibers from the bundle branches to the ventricular walls. The rapid conduction from the atrioventricular bundle to the ends of the Purkinje fibers.
That answer your left
allows
atrium
the
question?
ventricular muscle cells to contract in unison, providing a strong contraction.
I like my stories better.
Same.
This animation explains how a cardiac cycle is produced by electrical impulses in the heart. The cardiac cycle starts when an electrical impulse or action potential is generated by the sinoatrial node. The electrical impulse travels along specialized conducting fibers in the walls of the atria, stimulating the atria to contract and pump blood into the ventricles. In the normal heart, impulse travels very rapidly. As a result, all the muscle cells in the atria contract together, producing a coordinated pumping action. The impulse also travels across the right atrium to the atrioventricular node, where it is delayed slightly to allow the ventricles to relax and fill with blood before they contract. The impulse travels along the bundle of His, where the conducting pathways divide in two, forming the left and right bundle branches, which lie in the interventricular septum. From the bundle branches, the impulse spreads into the inner walls of the ventricles via specialized conducting fibers called Purkinje fibers. Finally, the impulse travels up the outer walls of the ventricles towards the atria. The rapid and controlled spread of the electrical impulse through the ventricles stimulates the muscle cells in the ventricles to contract together and pump blood efficiently to the lungs and body. As you will see, during atrial fibrillation, the electrical activity of the atria becomes disorganized. As a result, the pumping function of the atria is lost, and the rhythm and efficiency of the entire heart are disturbed.
The heart's conduction system controls the generation and propagation of electrical signals, or action potentials, that cause the heart's muscles to contract and the heart to pump blood. This electrical activity can be measured at electrodes placed at specific points on the skin, from which a composite recording is produced in the form of a graph. This recording is known as an electrocardiogram, or ECG, sometimes referred to as an EKG, a tracing of the overall electrical activity of the heart, resulting from the propagation of many action potentials. Let's look at what happens during a single beat of the heart and how these events are depicted on an ECG. In a normal heart, each beat begins in the right atrium with an action potential signal from the sinoatrial or SA node, the heart's natural pacemaker. The signal spreads across both atria, causing the muscle cells to depolarize and contract, inducing a phase known as atrial systole. On the ECG, this atrial depolarization is represented by the P wave. The period of conduction that follows atrial systole and precedes the contraction of the ventricles is depicted on the ECG by the PR segment, a flat line following the P wave. When the signal leaves the atria, it enters the ventricles via the atrioventricular or AV node, located in the interatrial septum. It enters the bundle of His and spreads through the bundle branches and a large diameter Purkinje fibers along the ventricle walls. As the signal spreads through the ventricles, the contractile fibers depolarize and contract very rapidly, inducing ventricular systole. The ECG's QRS complex represents this rapid ventricular depolarization. Atrial repolarization also occurs at this time, but any atrial activity is hidden on the ECG by the QRS complex. Finally, as the signal passes out of the ventricles, the ventricular walls start to relax and recover, a state described as ventricular diastole. The dome-shaped T wave on the ECG marks this ventricular repolarization. On the ECG, the ST segment depicts the period when the ventricles are depolarized. The QT interval represents the time it takes for both depolarization and repolarization of ventricles to occur. The sequence of events just described and the associated ECG trace repeats with every heartbeat. Remember, an ECG is not a tracing of a single action potential, but an amalgamation of the many action potentials that constitute the electrical activity of the heart.
All right, so when you start having a question, yes.
So during that, when is, so for quarters,
What of course, when they hit it during the T wave, during the repolarization phase.
that's the little window that, where it could happen?
So what of course happens? When you hit it right here while this is going on, you punch them in the chest. Once during repolarization, that's causes what of course. Yes.
What? When you put a pacemaker in, what does that do?
So you put a pacemaker in, that's when the last thing notes, yeah. So you just have like one ventricles go pump, pump. The ventricles can only beat about 20 to 40 beats a minute. So they're not really very efficient. They're kind of like your fourth string quarterback.
Yeah.
So what you do is you put a pacemaker in, is if you put the pacemaker into the right atrium, and what it does is it puts a signal there that replicates the depolarization of the SA net. And then it runs at 80 beats a minute all day long.
Is it like battery power?
It's completely battery powered. But you gotta go in every 5 or 7 years and have a battery replaced in your pacemaker.
Is that under the?
Why you wanna stay, yeah, usually it's under the skin, but it's usually up here in the left clavicle. Then they run it over, then they run the wires around and put them directly planted into the atrium. We actually have a video on how they do it, it's pretty cool. Yes,
What's the problem with you during, depolarization?
what authorities? Best way to kill someone. Fastest way. All right, so your coronary arteries. So the first artery is off the aorta. When fresh blood comes out the aortic valve, the first thing it does is first artery is off the aorta are the coronary arteries. So the heart refuses itself first. So it's kind of like when you buy Girl Scout cookies for your kids, but you eat the first row of cookies. That's how this works.
The first row.
This is how your coronary arteries work.
Right?
This is important to know when we get to start going over AMIs and STEMIs.
In this video, we're gonna look at the coronary artery and.
Better pay attention to this. I strongly recommend
So the
it.
coronary blood supply is the circulation of blood in the blood vessels of the heart. You have coronary arteries and the veins. Let us look at the coronary arteries first. Coronary arteries supply blood to the heart muscles. So we'll first look at the anterior view of the heart and look at coronary arteries from there. So here we have the aorta in red, rich in oxygenated blood. The two main coronary arteries are the right coronary artery and the left coronary artery. Concentrating on the right coronary artery, it will divide into the right posterior descending artery that goes around the back. And we have also the acute marginal artery, that the small part that you can see in the front. And these arteries.
Oh, was it? Now look what you made me do.
Armando has to, and these arteries from the right coronary artery will supply the right atrium, the right ventricle, and the sinoatrial and atrioventricular nodes, which are the conduction systems of the heart. Unfortunately, I have not drawn these names here. Anyways, we also have the left coronary artery that will divide to the left anterior descending artery and the circumflex artery. These arteries will supply blood to the left atrium and the left ventricle. Now, if we look at the heart from the posterior view, so from the back, here we have the left side of the heart and here we have the right side of the heart. And just so we know where we are, this is the right atrium here, and this is the left atrium here. Now let's continue looking at the coronary arteries, which came from the anterior view. This is part of the right coronary artery, the posterior descending artery that wraps around to the back here and supplies the right ventricle and the right atrium with blood. On the left side here is the circumflex artery, which I mentioned, that wraps around and supplies the left atrium with freshly oxygenated blood. Wherever there are arteries, there will always be veins. The veins will leave the cardiac muscle cells and will bring the deoxygenated blood back to the right atrium through the coronary sinus. So the veins that will bring the deoxygenated blood back to the right atrium, it will bring it through the coronary sinus. So all the deoxygenated blood from heart muscles will go back through the coronary sinus back to the right atrium. You have the small cardiac vein from the right side of the heart joining with the coronary sinus. And then the middle vein from the right ventricle here joining onto the coronary sinus. We also have the posterior vein from the left ventricle joining onto its coronary sinus, bringing back deoxygenated blood to the right atrium. Here we have the great cardiac vein.
All right, that's enough of this guy. There's your arteries and your veins. Any questions? You should already know that. All right, so when your heart starts getting a lack of blood flow, generally from clogged up coronary arteries, it lets you know. When it starts getting ischemic, it lets you know with pain and discomfort. And they call that pain and discomfort angina pectoris. That's the name of the pain. Angina pectoris. And that is pain in the chest or discomfort in the chest from cardiac ischemia. Remember, ischemia is hypoxic tissue. If that blood flow, if that blood flow does not get restored, those cells will die. Generally have about 90 minutes is the window from the time it starts. When cardiac tissue dies, that's called an acute myocardial infarction. Acute means it just happened. Myocardial is your heart muscle, and infarction means death of tissue. Acute myocardial infarction. You will commonly see abbreviated AMI. They'll say you had a huge MI, meaning myocardial infarction. The layperson name for that is heart attack.
So I'm asking you the acute title in front of something. What is that typically?
Means it's new, it just came on.
Okay.
Whereas in chronic means it's always been there and will be there till they die.
Gotcha. So it's not a specific place. It's like
Right. Acute means it's a new onset.
Gotcha.
And obtuse means new onset but wider. No, it's a geometry joke, sorry. Acute is less than 90 degrees, obtuse is more than 90 degrees. Sorry.
You said it was 90 minutes ago, or-
Yeah, generally, you got about 90 minutes to get the blood flowing. And that's critically important for you to know as EMTs, because there's reasons, which we probably won't go over till Sunday, but we're not gonna have time tonight. It's already almost break time. So what causes cardiac ischemia? The main culprit is a disease called atherosclerosis. And that's the buildup of fat plaque on the insides of your coronary artery from first world living. There is nothing better than pizza, beer, cheeseburgers, and tacos. Watching the game instead of exercising. I can exercise after I'm dead. Carry my casket around the track.
You do lose a lot of weight after you die.
Huh?
You do lose a lot of weight after
You
you die.
you lose a ton of weight after you die. Nah, the bone, it takes a long time for bones to deteriorate. It's true. But if they don't cremate you, you're the most popular guy at Halloween every year for decades.
Oh. That's not good.
So just like a pulmonary embolus, there are endless or multiple, not endless, there are multiple risk factors that put you in this position. And the more of those you have, the more likely, the more of these risk factors you have, the more likely you are to have the problem. Makes sense? Kind of like a staircase. If you got one bad step, probably not a good chance you're gonna fall through the stairs. If you got 7 bad steps, you're gonna fall through the stairs. Exactly, yes.
Once you get a buildup of,
Black.
plaque, whatever else is in there. Does it ever go away, or do they just have to?
It does heal. And you gotta say, yes and no. You can, through medication and diet, especially Mediterranean diet, it does get better, yes. You can stop from having a complete heart attack and stuff. Does the plaque ever go away? I don't believe they've come up with medication for that yet, or a way of doing that. Now, if it's dental plaque, you can floss, but can't really do that. So they can dilate the arteries, like they can bypass and they can dilate arteries with stents, which we're gonna go over. But for the actual removal of the plaque, I don't think so. The lifetime chronic disease. Yeah, somebody could get away an enzyme that goes in and eats our bacteria, that goes in and eats plaque, and then dies when the plaque's gone. That'd be good. You'd engineer a bacteria to put in someone's blood. I don't know who you're gonna get to volunteer for that. You have to go to a third world country and do a hospital, but
Whoever makes that.
no one has any rights. That's what they do, you know that, right? Drug companies, biomedical companies.
Oh, yeah.
Go to third world countries or China. And yeah, just contract, pay the government some money, then you can just test people all day long.
Oh, yeah. That was pretty neat.
Also, I mean, it's.
How you get rich.
I mean, in the US, who do they have?
In the US, you can't do anything.
It's fun, but in the US, who do they have to do medical trials?
College.
Beagles, rabbits. Yeah. We're
Death
recording,
row-
I can't
death row
tell my true feelings on that. And if you're on death row anyway. Alright, any questions on angina pectoris? So angina pectoris will usually go away with rest or taking nitroglycerin or a medication. If it lasts longer than 15 minutes, even with rest and or nitroglycerin, you probably are having a heart attack. Very, very serious. Generally, most cardiologists tell their patients don't even call 911 until you've taken 3 nitros and it hasn't gone away. So why does nitro stop angina pectoris? It's a smooth muscle relaxer. So your arteries are muscles. So when it relaxes the arteries, they dilate. So even though they got a bunch of plaque in them, if you double the size, you get more blood flow through, but this heart's not ischemic anymore, that stops the chest pain. Now, when you have a heart attack, though, that's when a piece of plaque is broken off and it's blocked the artery. So all the nitro in the world's not going to help that. And everything distal to that blockage will die if it doesn't get opened in 90 minutes.
What happens if somebody like it's a clot and then it dilates, keeps going further down?
Yeah, or generally it's blocking it. I mean, it's like a door. It's like plunk. So you can't dilate it that much. Dilation's not unlimited. You can only dilate so much.
Yeah.
Any questions? And it's usually not just one clot, it's usually multiple ones that are breaking free. So that's why aspirin's so critically important to get on board as soon as possible with chest pain patients, because the aspirin will actually dissolve the clots in route. The ones that are flowing through the bloodstream, it can dissolve. It can't dissolve the ones already blocking an artery, but it can dissolve flowing clots. So it will stop heart attacks from getting bigger. Yes.
Does anything ever dissolve plaque?
Oh, not plaque, they can dissolve the blockages. There's a drug called TPA and another one called TNK. That can do it, yeah, they're extremely dangerous drugs, no, Fairweather's so good. And we're gonna go over that in this presentation. But it's, well, in fact, we had a fatal today. They gave the medication, the guy died about 40 minutes later. Yeah. Because it can save you and it can kill you. Very, very dangerous drug. No, it's because it's not prejudice. It literally dissolves every clot in your body. So if you had having a small brain bleed, or if you have a recent injury somewhere, or you have an aneurysm somewhere, it's going to rupture and you're going to bleed internally. Yeah, I mean, sometimes even the most minute bleed, then it just makes it huge. It's literally, that's what happened today. The guy had a small bleed in his head. They gave him the medication to try to dissolve the clot in his artery, and then he just stroked out.
It's just like.
Not a lot. They do a 2-page screening. And if you answer yes to any one of the things like 2-page screening, they don't give you the drug. And if you're over 85, they don't give you the drug, or over a certain age, they don't give it to you. And the best way to do it is to go to what's called a cath lab. They run a catheter up through your femoral vein in your leg and into your heart, and then they shoot dye in there so you can see exactly what the clot is. Then they put a wire through it, and then they dilate the artery with a stent, with a metal stent, stainless steel stent, and open it that way. That's the best way. But you got to be in there in 90 minutes from time to start. So if you're a long ways from someone that can do that, you might be better off stopping and getting a drug.
So is it like blockbuster for strokes?
It is the clot buster for strokes. It was originally designed for heart attacks. And just recently, in the last 10 years, they started using it for strokes. All right, once you guys go to break, be back at 5 minutes after 8. What's left of your teams? And we will start with skills.
What happened? Why are you asking me? Fucking Danny. What happened? What's his name? I can put the little green bean in a jar. I don't know. It's just. Oh, that's that. Yep. No, I'll put it over here. This is what we're talking about.
Yes, I have.
Okay, what did we get?